currently in Lynch syndrome, there are several lines of evidence that point to the role of non-steroidal anti-inflammatory drugs, or NSAIDs, such as aspirin and more recently naproxen, towards chemoprevention in Lynch syndrome. This includes the CAP2 study, which studied a high dose of aspirin, 600 milligrams a day, for a period of 2 years among healthy Lynch syndrome carriers. And in long-term follow-up, it was found that treatment with high-dose aspirin for 2 years was associated with a decreased incidence of colorectal cancers as well as non-colorectal cancers in Lynch syndrome. So those data point to what is currently regarded as a reasonable standard of care option for chemoprevention for patients with Lynch syndrome. There are several ongoing studies currently of aspirin is truly necessary, or whether lower doses may be just as efficacious, as well as other NSAIDs, like I mentioned, naproxen. And also there are studies to better understand the mechanism behind why NSAIDs are associated or leading to decreased incidence. But the Nous-209 study was a single-arm study in which all participants received vaccination. We did not, within the current study, incorporate a comparator arm that incorporates aspirin or other NSAID. But certainly that is going to be the key next step that we believe will be essential to validating this sort of immune interception strategy. Ultimately, of course, the beyond looking at immunogenicity, really, of course, our ultimate objective is to confirm that vaccination or vaccination strategy in general leads to a reduction in the incidence of neoplasia in patients with Lynch syndrome. So at present time, we don't have sufficient data to make a comparison between aspirin as well as between aspirin and Nous-209. But certainly that will be among the key questions that will be explored, we think, in future studies. So currently, aspirin and or NSAIDs in general remain the standard of care, but we hope that vaccination will become a compelling option for patients who may not be able to tolerate aspirin or NSAIDs. And of course, long term, we do want to see whether there may be combination strategies, which may help potentiate the efficacy of both NSAIDs as well as vaccine-based approaches.